Hi, everybody. Thank you for coming to my webinar as part of the Humanity and Health webinar series. I'm going to be talking today about an issue that I think is concerning to everyone, which I've titled COVID-19 and the Assault on Public Health. We've all seen disturbing images and read news stories about health workers being physically attacked, receiving threatening emails, being targeted by protests. And so I wanted to explore that a little bit from an anthropological point of view and connect it together with other sort of macro level processes that I've seen and observed and been studying for the past decade or so. So I've broken this talk down into three parts. Part one I've called Stranger Pandemic Things, which again is just what I mentioned, just the strange sights of seeing people attack public health workers who most of us, I assume in the university community, view as heroes in this context. Part two, I'm calling The Great Unraveling. And so I'm going to talk about three interrelated processes that I think have come together to create the events that we've seen in part one. And then I have a short section on conclusions, just sort of speculating what's next and where things are going to go from here. So let's dive in. I'm referring to this as the prelude. So during the Ebola epidemic in 2014 in West Africa, if you followed that at all, you might have seen some equally disturbing images like these. Billboards as part of a public health campaign to inform people in very brief, very clear terms, Ebola is real. As well as instances of riots, people attacking health workers, one burial team who was killed and hidden in a well. At the time, especially in international media, these attacks on public health workers were framed in somewhat colonial terms as, look at what these, they didn't use the word primitive, but look at what these tribal populations are doing. And, you know, there was an implicit narrative of like, aren't we glad we have science and science education in the US? As an anthropologist watching this, I felt that it was not that clear cut what was happening, and that it would be very likely that similar things would happen in this country if an outbreak like Ebola happened. So now fast forwarding to 2020, it has been very easy to see that disinformation, rejection of scientific models of disease, and lots of other things have come together to create multiple sort of strains of opposition to public health in the context of COVID-19. So it's very easy to find people protesting that public health measures are part of a socialist agenda, part of a communist conspiracy, a power grab by unelected officials who are up to no good, a prelude to forced incarceration, and a pathway to genocide. This slide here that you see from Texas pretty much maintains that some of the leading public health experts, Dr. Anthony Fauci, along with Bill Gates and others, are part of a satanic cabal. I suspect is part of a QAnon belief system, but I'm not completely sure. But anyway, there is a lot going on. And then here closer to home, I've been lurking about social media and watching some live stream city council meetings. And these are all direct quotations that I took from some of those contexts. So these are all from people in Oklahoma. I won't read them all, but you can see just from a quick overview, people insisting that the CDC is planning to imprison people in mandatory quarantine camps and then forcibly inject you with unknown substances. Others are drawing comparisons with Nazi Germany, saying, you know, when the CDC established guidelines for quarantine camps, which they actually did not do that, but it's very embedded in this discourse, that it's just the first stage in a larger process of ethnic cleansing or forced incarceration. Other people talking again about socialist agenda, attacks on personal liberties, and then religious opposition. So all of that is very much been a factor here in Oklahoma. So now to talk about why this is happening. Again, I've divided this into sort of three interrelated trends. I'm going to try to give each of them equal time. I will confess I have a great affection for the historical material, and so I'll try not to spend too much time on that. But it is very interesting and important to revisit the early history of public health. So I'm going to start sort of in the turn of the century, early 20th century, then talk about the end of the Cold War, and then some of the larger institutional changes that are happening today. So historical amnesia. Some of the public health measures used to control COVID-19 felt very foreign to people. So the terms like socialist agenda or Russia or concentration camps, those are all examples of authoritarian states in Europe in the 20th century. But nobody seems to remember that between 1900 and 1930, the US Public Health Service engaged in very aggressive, intrusive, sustained, controlling, undemocratic interventions to control and prevent some of the most deadly infectious diseases that used to circulate here in the United States. We have all benefited enormously from these early decades of aggressive public health, but we have unfortunately forgotten that public health is, especially in the face of a lethal disease, very authoritarian, because to do otherwise means you're letting the microbe out to attack vulnerable populations. So this is a slightly difficult to read slide, but it does show the overall decline in mortality from infectious disease in the United States from 1900 to the year 2000. And so one of the things I want to point out is that the steepest decline happened between 1900 and 1940. So that was before antibiotic drugs, before most vaccines. And so the only measures to control these lethal pathogens were just basic public health measures. Isolation, quarantine, mitigation, and those can be extremely successful. And again, that all happened here. It was just so successful that we forgot about it. So here are a couple of historical vignettes from the great state of Texas. This is a pamphlet published by the Laredo Chamber of Commerce, I think in 1920. It's a literal declaration of war. They are declaring war on Anopheles mosquitoes, which spread malaria throughout the region, and Aedes mosquitoes, which spread dengue. Are very different. Anopheles mosquitoes are more of a wild mosquito that would be sort of in swamps and river basins. Aedes mosquitoes are domestic mosquitoes, and so that controlling Aedes mosquitoes requires very intrusive domestic surveillance and control measures at the household level. Texas passed a number of laws, very authoritarian laws, to mandate things like home inspections, window screens. The reason that cities in the United States, just everybody has window screens, is that these laws were passed and again sort of forgotten about. They had special blueprints for outhouse construction so that you would not have flies getting into households, and disease surveillance with serious penalties for noncompliance. So in this flyer, and again, these came from the National Archives, records of the U.S. Public Health Service, there is a lot of language used on how to treat the problem of noncompliance. And so in this time period, Texas was not having any noncompliance. So you can see the language is very significant. The names of all people refusing access to home inspectors, refusing access for people coming to their houses to inspect for mosquito breeding, are turned over to the police and dealt with as the new law directs, which was a $25 fine or 30 days in jail. Do not pass go, do not collect $200. These were the rules, and you were expected to follow them. So here's just some more ephemera from that time period. On the left, you'll see this is a home inspection notice, and these were part of every state and county health department during the period of malaria eradication and control. So health department personnel would take this little card and go house to house, even in remote rural areas. Any house or rural area that had a problem, a team of public health personnel would come out and either physically rearrange the landscape to eliminate mosquito breeding spaces, and also inspect window screens and the other strategies they use to keep Anopheles mosquitoes out of people's houses. And this graph on the other side is just a chart showing how successful these measures were. Again, very little, and there's no vaccine for malaria, very little drug treatment other than quinine. So with these mosquito control measures, they were able to reduce the rates of malaria in these communities almost down to nothing. And again, right here in Oklahoma, this slide just shows the Oklahoma quarantine law that was passed in 1914 that sort of says if smallpox or any severe infectious disease arises, the city will establish a pest house, which means a mandatory quarantine facility where all infected people go. And you'll notice in the last sentence, it says, you know, the city has to take care of people, bring them food and medicine and provisions, but forbid and prevent all communication with any house or family infected with any contagious or pestilential disease. So it's pretty severe. And this is actually before the Soviet Union really got established. So it doesn't quite work to call this socialist. It's just authoritarian public, meaning government health measures. In the last bit on the historical amnesia, these same public health officers that worked to control malaria in Texas and Oklahoma, they did amazing work internationally, which has also sort of been forgotten. So they were stationed in the Dominican Republic, Nicaragua, Cuba, Brazil, West Africa, and they did exactly the same work. House-to-house inspections, window screens, worked with national governments to control disease at the source. And one of the long-term results of that was increase in trade and travel and fewer restrictions on Americans traveling to these countries or people from these countries traveling to the US. In this green journal here, Public Health Reports, is the historic journal of the US Public Health Service. And if you look at older copies of that, they have reports from every country in the world where they had health officers reporting on levels of communicable diseases. And it was all centralized in Washington so that appropriate restrictions on trade and travel could be put in place if there was a severe outbreak somewhere. Okay, so where did all that go? All of that public health knowledge, expertise, all of those public health successes, where did they go? Well, this section I'm calling the Great Unraveling, and I'm sort of proposing that three trends have contributed to both the historical amnesia and the contemporary objections, popular protests against public health measures. And the first one of these I would date back to the collapse of the Soviet Union in the early 1990s. That process of collapse led to a tremendous revitalization of, and many people who were ferociously against the Soviet Union saw the collapse as evidence that free markets are the way to go, that state governments, the Soviet Union was a very statist, state-controlled sort of everything, that was now a relic of the past. And a lot of religious communities who had objected to the Soviet Union because it was forcibly secular, was a secular state, they also gained a lot of energy from the Soviet collapse and additionally validation. And the final trend, the term twin insurgency comes from an article published by historian Nils Gilman, in where he talks about more recent developments that have come after the Soviet collapse, sort of leading to extremes in global inequality, and that the remaining secular states around the world are now under assault by these forces. So moving on, talk a little bit about the Soviet collapse. This book cover that you see in the corner is Laurie Garrett's book, which was published in the year 2000. And the title is Betrayal of Trust, Global Health. And so at that time, she traveled throughout many former countries of the Soviet Union and talked about how the collapse of the Soviet state led to the collapse of their public health systems. And coming out of that through the 1990s were multiple epidemics of what were considered diseases of the past that a, quote, developed country like the Soviet Union had always, prided itself on having controlled these outbreaks of diseases that were easily preventable. And they included malaria, typhoid, tuberculosis, HIV first made its appearance in the post-Soviet world. And so there was a health crisis that happened along with the Soviet collapse. And Laurie Garrett was one of the first people to draw attention to this. But then the other part of this book, is about the underfunding of public health in the United States during that time period. So again, the collapse of the Soviet Union led to the collapse of a lot of belief in the power of a secular state to contain lethal infectious diseases. And so much of that shifted to what we would call the private sector, but in the post-Soviet world, that gets a little confusing, but it stopped being a state responsibility. The religious opposition, again, drew enormous energy and strength from that, and now has reached a point in this, the image that you see here is a book cover that came out very recently. And so it's the energy that was drawn from the Soviet collapse has really led to a much more religious interpretation of things like public health measures, and intensified religious opposition in some religious communities, opposition to any action taken by the secular state, which is viewed as not legitimate. And some of these religious groups really do want to replace the secular separation of church and state model with an intentionally faith-based model of government. And so in this book, which again came out just either last year or very recently, there's a quotation where you can see the Democratic Party, which has historically been more in favor of public health, is now itself termed socialist. And so there's been a conflation of secular state government with Soviet-style socialism. This is another book that just came out this year, and it is from a religious community, an evangelical physician who is again making the argument that secular state government restrictions on anyone's behavior, belief, or activity, especially the closing of churches during the pandemic, is equivalent to a Soviet-style repression of religion. And so that's why I pulled that quote. Today's Democrats, secular, godless, secular, and godless, to the point of being communist, which again, I don't think anyone who works in public health would accept that. But that's sort of not the point. It's that individuals and organizations like this is the rhetoric that they've chosen to frame their opposition to public health. And finally, I'll talk a little bit about the twin insurgency. This article was very influential. I think it was published first in 2015. I'm not entirely sure. I have a link there on the bottom of this page. And so he makes the arguments that since the end of the Cold War, the Soviet Union and the United States during the Cold War both embraced what we would call the ideals of social modernism. And that is a belief in progress, a belief that life gets better over time, a belief in the ability of science to solve social problems. So these are all things that the American belief system and the Soviet belief system sort of had, even though they had radically different plans or formula for how they intended to accomplish these goals. So in this article, he makes the argument that when the Soviet Union collapsed, it led to a tremendous concentration of wealth in some groups in former Soviet states. You may have heard the term oligarchs associated with Russia. In other post-Soviet countries, the same pattern has been manifest as tremendous concentration of resources. And he makes the argument that these sort of new billionaires and increasing wealth inequality has also been a factor here in the United States, that they have sort of formed their own plutocratic class. And he calls it a plutocratic insurgency, meaning that they don't like to pay taxes. They see themselves as globalized. They travel freely on private jets. And so the idea of citizenship and tax obligations to a specific location is very foreign to them. And they have so much wealth and power that they are able to both avoid taxes through sort of clever moving of money and offshoring, but also by funding political opposition movements that are intentionally anti-tax. So that's the plutocratic insurgency. And then on the underside, he calls what we would say the expansion of organized crime groups, the globalization of organized crime groups, he calls a networked criminal insurgency, which is also very much against a secular, social modernist state. So they also avoid taxation. There's tremendous wealth concentrated in criminal hands. And a lot of that wealth is directed toward attacking the power of law enforcement, trying to carve out an autonomous zone free of political surveillance. And some of these groups have been very successful. Like there are now parts of Mexico and Central America where the cartels control enormous amounts of territory and the national police just don't really go in those spaces. So he's making this sort of broader argument about institutional change. And I'm adding in at the bottom that both of these insurgencies really create lots of opportunities for pathogenic microbes. Because if you have a chunk of territory that is technically part of a nation state, but is really controlled by criminal entrepreneurs, you don't really have a lot of public health surveillance in those spaces. So it creates blind spots in disease surveillance when political space is fragmented or in sort of a patchwork of resources being very concentrated in some areas, but really unavailable in others. So that's sort of the last trend of the sort of international political economy side and institutional change since the end of the Cold War. And now I'm giving you some information about sort of how those trends have contributed to both the problem of lack of information about pandemic mitigation measures, lack of awareness about what public health is, and of appreciation for what public health can do in the face of a pandemic virus like this one. So this chart on the top with the different colored, what are those polygons? That's actually a map of the US, and the different colors represent the extent of public health staffing and funding decline since between 2010 and 2019. So the darker brown little shapes, those have had over 30% reduction pre-pandemic of basic public health staffing positions in state and county health departments. You can see Oklahoma is there around the 15%. In some ways, this map or this chart is, it doesn't quite capture the full extent of defunding of public health. I did some consulting work for an organization around right after the financial crisis that involved phone interviews with people in state and local health departments in Rhode Island, Georgia, Maryland, and a couple of other places. And at that time, which again predates this map, many of them were talking about absolute decimation of the workforce, that they barely had enough staff to even do basic functions. And they were being confronted with all of this new need because people were losing health insurance, they were losing jobs, they were losing housing. And so this graph sort of shows what happened in the recovery period after the financial crisis, and it's bleak, and what came before was even bleaker. And then on the other side, this is sort of the other component of this. As the public health sector has shrunk from underfunding and political opposition, it creates a space for entrepreneurs to market. In this case, it's a fake COVID cure, but you can see sort of the fusion between religious opposition to public health and the belief that markets must be absolutely free and unregulated, and that these two things are now sort of combined together so that televangelists like Jim Baker are marketing fake coronavirus cures and will reject and resist any attempt by a secular state, secular public health agency to tell them you can't do that. On the last sort of bullet point I have on the slide, like and I think everybody in public health will have the same heart attack when they revisit this. There was a senator, and I think it was either from my home state of Kentucky or from Texas, who a few years ago was so libertarian when people asked him, like, should restaurant workers have to wash their hands? Should that be a law? He said, no, that is unacceptable. And so you can just see how the forced retreat of public health creates these new opportunities for pathogenic microbes to spread. And so a short slide that just sort of talks about the human costs of these trends, the loss of public health. Over on the graph that says daily cases, this is daily COVID cases in 4 countries. You can only see 2 of them, the United States and the United Kingdom, which have these huge holiday-related surges that are now diminishing. But on the very bottom, there are 2 pretty much flat lines that represent daily COVID cases in Australia and Vietnam. So those are 2 countries that really did push an aggressive public health response, including aggressive testing, isolation, contact tracing, quarantine. Again, it's not about a cure, it's not about the vaccine at this point. And they were able to avoid these giant spikes in cases by using these public health measures. On the other side is the daily deaths. Again, the human toll of this pandemic is still being tallied. In addition to deaths, I also want to mention that I think up to 1/3 of COVID patients have long-term symptoms, longer than 6 months. That includes pain, fatigue, brain fog, in some cases problems with coordination, gastrointestinal problems. So even when the pandemic is over, the disease may still be lingering and causing a lot of morbidity in some populations. But this chart shows daily deaths. And again, you can see the US had a huge spike in the past 2 months. The United Kingdom sort of did, but nowhere near at the level that we did. And then I've added Canada to this map, which again, has had some retrenchment of public health, but not quite at the level that we've had in this country. And also Vietnam, Taiwan, and Australia, which are virtually flat lines, because when you don't have a lot of COVID cases, obviously you don't have a lot of deaths. And so now let's talk a little bit about what's next. I put this slide up. This is today's Oklahoma COVID graph. And it's good news. So everything isn't horrible, but at the same time, unless there is reinvestment in public health, I think with climate change, ecological disruption, and political instability, which is now a problem here in this country, all of those things also create new pathways and opportunities for lethal infectious diseases. Without political will and economic resources, public health is likely to continue to contract. Many people in public health have quit this year because they didn't like the death threats, the cyber stalking, the doxing, and the harassment that came with their jobs. They were very likely already in positions that were underfunded. So that also will create a new vulnerability. And if there is another insurrection at the US Capitol that actually does seize control of the center of government in this country, it's very likely that there won't be much left in the way of public health after that. So those are all dark trends. Again, this little sliver of good news, the private sector has done very good at creating safe, effective vaccines. So for this pandemic, those vaccines are a great sliver of good news, but I'm really more concerned about the next pandemic, which may have a much higher death toll. Some of the strains of avian flu that people are worried about have up to a 30% mortality rate, as opposed to COVID, which is maybe around 1.5%, depending on different strains and different populations. So some good news, but also some definite concerns about the future. And very last slide, a longer term view, just again, speaking as an anthropologist, social scientist who has studied the post-Soviet world quite a bit in my career. One of the more insightful books that I found talking about the changes that we see in Russia from, say, 1991 to today is this book that's, the cover's here as an image, Contemporary Russia as a Feudal Society. And so in the book, the author talks about how the institutions, basic institutions of life in Russia have really changed over the past decades to where there's a lot that looks and feels like feudalism. And so there is a super wealthy oligarchy, but those oligarchs, their ability to retain that wealth and power and resources is contingent on favors from the leadership of the country. There's a lot of what we call privatization of security. So people have private armies. Some of them, it's sort of hard to tell when a private army becomes an organized crime group. So there's just a lot of uncertainty about what that actually means. And one anthropologist named Valery Tishkov, who looked at these types of situations, he studied Chechnya, and he used the term demodernization to talk about the social and institutional changes. And also, it sort of maps onto what this book is talking about with the transition to a more feudalistic type of society. So if that does happen in terms of social institutions in the United States at the end of social modernism, will it signal a return to pre-modern health patterns? So can we expect malaria to come back to Texas, or yellow fever, or diphtheria, or dengue? It's entirely possible that in this era of globalized trade and travel, humanity and health will have a different kind of relationship than they had in the 20th century, which was more the era of social modernism. So that is the end of my talk. Thank you for listening, and I will be happy to take questions.
Okay, thank you very much for that very interesting talk, Dr. Hirschfeld. It was nice to see a different perspective than the public health perspective that I'm steeped in. If anybody has any questions, please feel free to send those along. I don't see any yet, so I'm going to ask one. A lot of the problems that you identified going on in our country happened during this pandemic under the last administration, and I'm wondering if you see any changes coming forward with our new presidential administration.
That is a great question. And to be honest, yes and no. So I think everyone, certainly in public health, was very disheartened by the early sluggish response to the pandemic, the denialism that was all characteristic of the previous administration. And I think we're all tremendously encouraged by the improved vaccine rollout, the clarity, transparency in decision-making, and just the rhetorical support for public health that we're hearing from this administration. So personally, I just feel every day just this sigh of relief that I feel like we have people in administrative positions who are very capable and doing great work. My concern is just that we have seen at least some subgroups very willing to use violence to seize political power. And having sort of followed some of the news yesterday about the CPAC conference that was happening in Florida, I didn't hear, at least in the media reports that I read, any regrets about that violence. And so I just have to assume that maybe next time they will just be better at seizing power. I hope that's not the case. But that would be my main concern going forward. Like, I feel like this administration is doing a really good job, but I feel like a critical percentage of the country is just opposed at every level, whether based on misinformation or something else. And so that does give me concerns going forward.
Excellent. So I kind of agree. I'm not real sure what's going to be happening with our new administration, with the other political issues going on and our federalism adding this. So a question that someone has asked is, here, public memory in the US puts emphasis on institutional learning moments. Hurricane Harvey, the recent snow and ice storm in Texas, do you think that COVID-19 will be a lasting learning moment for the institution of public health, or will it fall by the wayside?
That is also a good question. I wish I did have a crystal ball. Like, I sort of feel like there's going to be a generational difference, because I feel like for students who have never had to go through anything like this before, I think it's going to be seared into their minds, all of the things that they have lost, just, you know, the loss of family, but also the loss of things that they had planned for their young adult years. And so I hope that it is a big learning moment for younger people to know that it didn't have to be this way, and just basic public health institutions that have been underfunded can prevent it next time. But at the same time, I just feel like there are a lot of anti-democratic forces at work now. And again, if they are successful, then it's clearly part of that platform that the dismantling of the public sector at all levels is sort of the goal. And so I don't think that the people who most would benefit from learning the lesson of this pandemic are necessarily the ones who are learning the lesson.
Good point. So I have another question. Until I get more from people, I'll keep asking stuff. So US Public Health Service has this long, interesting history, including all the work that they did that was pretty strict early with malaria and dengue and yellow fever. And moving on, they haven't been as obvious in recent years, but they also have this history with some kind of shady experimentation, like the Tuskegee syphilis experiment. So how do you balance this history in a way that we can look at them moving forward?
That's also a great question, because I feel like sometimes I tend to maybe overly romanticize the good work that these early public health, and they were, when you read historical documents, it's including correspondence, it's very easy to sort of like have favorite people. You just feel like you have a relationship with this person because you've just read all of their correspondence for a year. And so I don't want to lose sight of things like the Tuskegee syphilis experiment, because that was also a product of this time period. And so clearly too much public health, or public health that doesn't have a strong ethics component or oversight or transparency, is capable of committing absolute atrocities. And I will draw a little bit on my research in Cuba, which I was there in the 90s. And so they were transitioning a little bit, but then they changed their mind. They were like, no, we're going all in on our Soviet style government. We don't care what the rest of the world does. And so there was plenty of evidence in that context of people who were treated horribly by the state healthcare system, and there were no alternatives. And so for a talk like this, I do feel like it's really important to emphasize that public health in a democracy that has accountability and transparency is way better than public health in an authoritarian state that uses its control of information to conceal its own misdeeds in the health arena. So, yeah.
Good answer. We have a question from Marilyn Corhonen. Do you have ideas about strategies to separate health policy from religious fervor and the related misinformation campaigns?
Do I have ideas? Probably not good ones. I just feel like it's just such a thorny issue. Like, again, from having lived in Cuba, I am big on religious freedom, and there need to be spaces where government just steps back. But at the same time, when people in those spaces are promoting disinformation or selling fake cures, then that obviously shouldn't happen. So I think, again, public health that is, something does come to mind, which is what happened in West Africa with Ebola, which is they just sent anthropologists into these communities, ideally people with anthropological training from these communities. And so the goal was to just improve the communication between public health agencies and people in remote communities in a way that was safe, that felt protected and familiar, and didn't trigger such a backlash. So potentially you could read this as a PR campaign for more medical anthropology to work hand in hand with public health to frame health intervention messages in ways that are appropriate and that don't make people feel like their religious beliefs are being trampled.
Thank you. We in public health need to be better at our messaging. I totally agree. So we have another question. Thank you for a marvelous presentation. I have a question. Can you explain how you believe what would be the most effective changes in public health education right now at both the K through 12 and higher education levels?
Great question. I love the idea of myself having absolute powers to rewrite curricula. And so honestly, one of the reasons I developed the Plagues and Peoples class, which is in freshman level gen ed, is that I do feel like the history of humans and their pathogens has not been part of our public discourse at any level. And so part of it, I think, comes from the controversy over teaching evolution. And so people don't understand how new diseases evolve. And this is a regular thing that happens. And that it's just something that humans have had to deal with from the very beginning. And so I think just putting in some of that history into, you know, a high school curriculum. And I know that a lot of schools will teach sections on bubonic plague in Europe, but that is an isolated thing. And I think it just needs to be taught as part of a continuity. And so, you know, pathogenic malaria goes all the way back to when humans first started practicing agriculture. And we've developed all these different ways and adaptations for dealing with malaria. And then poof, presto changeo in the 20th century, some countries were successful at eradicating it. But it doesn't mean that those countries are better or more civilized or more advanced. They just had better public health for a short period of time, but there's no reason that malaria can't come back to this country. And so we need to maybe stop teaching it just as this triumphalist narrative and more as just humans and pathogens have a long history and a long evolutionary history, and we should always expect them to come back. So it's like the horror movie with the infinite number of sequels. So it's just a different framing, I think, of the way things are usually taught in our education system.
Thank you. I like that, the triumphal approach versus what we really have.
Right.
I mean, we've been successful in eradicating one disease.
Right. But somehow we'd assumed that that was just going to, you know, be our future destiny. And I think that that's a mistake.
Excellent. So a follow-up to that was, where can improved funding for public health in the US be most effective for the present pandemic in your view? And what can be changed straight away during the Biden administration?
I mean, honestly, I feel like I'm being a little like self-promoting here, but I think medical anthropologists need to be going into these communities that have very inaccurate, just basic information about what a pandemic is, where they come from, and how they end. And so that would be one part. And the other parts, you know, I kind of feel like because these vaccines are so successful and they're just getting into people, and I'm thrilled that I got my first shot last week. I feel better already. So I feel like there's a potential for this pandemic to be over sooner. And I feel like what we need to do is, again, just make sure that the wrong lessons aren't learned. So this could easily be told as a triumphalist story of private sector vaccine development, which in some ways it is. I give them credit for these amazing safe vaccines. But at the same time, we always need to be thinking about the next one. What if the next one isn't so easy to tame with a vaccine, because many diseases aren't? What about inequality? What about the COVID inequalities that we know about? How can we better address those going forward? I do see, thankfully, attention from CDC and the Biden administration on reaching disadvantaged communities. But, you know, I always feel like you could be doing more. And if you don't have an anthropologist along with you to sort of make that process work a little better, then it may not have the lasting impact that you might want it to have.
Thank you. Yes, we need to do better at the disparity situation in general. And I think it's good that COVID has kind of exacerbated, it's not good that it exacerbated it, but it's good that it's shown a light on the situation.
Right. It made it visible. And I think too often in this country, because again, we sort of have this narrative of progress that like, oh, we've got disparities now, but we'll fix those, we'll get better because everything gets better over time. But really they've gotten quite a bit worse. And I think we need to understand that things, you know, the arrow of progress goes both directions, and a pandemic can really turn lots of things around, crash the economy, foment an insurrection. So all of these things are interconnected.
Excellent. So Sarah Tracy said that she was part of a Megapod vaccine, Megapod recently, a public-private partnership with Emmy Labs, OU Health, Norman Regional Hospital. There were a tremendous number of younger people there, as well as middle-aged and older folks. It gave me hope that the future of public health, for the future of public health. Even here in Oklahoma, you have framed much of public health in terms of political economy, I think rightly. Are there ways that you think we may capitalize on private capital and public health authority in the future?
That is also a really good question. And I think in some ways, private sector can do a lot of its own work, right? Like, if you are a PR executive from Moderna or Pfizer, you should be basking in glory and getting that message out there. And if you are somebody, like me, who just got that vaccine, like, let me do some PR for you because this has been a really great thing. I was also at that vaccine pod and was just thrilled, to be there, that the energy felt so positive. And so I think just rightfully recognizing those successes. Then also the one thing the private sector is not as good at is just comprehensive coverage. So in my mind, you do need the public health sector to make sure that these life-saving technologies can be equally available to people, and that groups that are remote or rural or isolated religious communities do have accurate information, ideally from an anthropologist. So quite likely, let the vaccine companies also hire some anthropologists to sort of talk up their product in the right places. So that's kind of my off the cuff sense, but that's an interesting problem. And it's one that anthropologists, I think, don't think about because so few of us work with the private sector, that we're just more focused on public policy. But I would love to see some of that going forward.
I thought that was very interesting. With the vaccine movement, right? There's the anti-vaccine movement. Oklahoma and Texas have a big history of this. What do you think about the legislation that people are trying to promote that's more anti-vax, and whether or not we should be considering this for employment?
Personally, I'm just old school. I think vaccinations, especially measles, do need to be mandatory. But I did see there is a bill floating around the Oklahoma legislature to make it like to make or to take away any possibility of mandatory vaccines in educational settings, including higher ed. And that is very disturbing to me. And so, again, I don't like to think about what it means going forward to have the public sector continuing to contract while the private sector is doing such great work, because I just remember how HIV drugs, which were miracle drugs, how they were priced out of reach for so many people around the world. And I just know also, if you look at what's happened with insulin prices, that diabetics absolutely can't afford it and are making horrible decisions, trade-offs about how much insulin can I do without. So I really feel like, even if the private sector does brilliant, innovative medical science, if you don't have a public sector that sort of helps get that to needed population so that everybody benefits, then it's going to be incomplete.
Good answer. So another question, do you think conspiracy groups like Q will be the primary drivers of distrust in public institutions? Or do you think the distrust of public sector institutions has been somewhat ingrained into our cultural discourse?
I think both of those are true. I think QAnon is a new phenomenon, and I still don't even know, even as an anthropologist, who studies sort of different kinds of cultural beliefs, I don't quite have my hands around what it is, why it's grown so forcefully and so powerfully in such a short time. So I think the lesson I would take from QAnon and public health is just the power of social media to shape perception independently of whatever other channels, right? Because I don't know so much about QAnon, but certainly the previous administration, just the term fake news for some audiences immediately devalued what we would consider mainstream media outlets. So they went from being considered, fact-based reporting to being biased and unreliable by some populations. And so that fragmentation and weaponization of the information landscape will make things much more difficult for everybody going forward. And I know that there are bills also floating around Oklahoma to penalize tech companies who try to silence disinformation or calls to violence. And so that's also worrisome that, anybody can put any information out there and there's nobody in power. Like, it's sort of the magic of marketplace of ideas, but you don't learn that the COVID cure that you bought on eBay is fake until it's killed you, right? Like, that's a market failure. And in strict libertarian terms, I guess that's what they want. But as a human person, I just feel like that's unnecessary suffering.
Agreed.
Mm-hmm.
I was kind of horrified that I had to tell people not to drink bleach during the pandemic. I had serious questions from smart people about that.
Yeah.
So one thing that I wondered about, it looks to me that vaccines might be a victim of their own success. We did pretty good with polio and smallpox, and you don't see people in iron lungs anymore, and you don't see people dying or horribly scarred from smallpox anymore. So do you think that might be part of one of the problems people have, not understanding the importance of vaccines?
Yeah, I definitely in this country, again, and I will put a little blame on what was called mortality transition theory in public health, which was that, okay, we've taken care of infectious diseases. Americans, you're going to have diabetes and obesity and heart disease, and then only those other countries have to deal with it. And obviously in a globalized world, that's not how it works. But the diseases that are least amenable to control by vaccines that are still big problems in the world, malaria, dengue, HIV, those aren't such a problem here, but that could change pretty quickly. And then suddenly we're confronted with, a lethal mosquito-borne disease that we don't have much for other than mosquito control. And I will point out, I know we're running short on time, but there was an outbreak of yellow fever in Angola in 2015 that was terrifying because it used up all the global vaccine supply. And the only way they were able to protect people was by diluting the vaccine, I think, to half or a third strength. And they had no idea that that would work. Thankfully, it did work. But even for vaccine preventable diseases like yellow fever, there's still a supply chain issue in that not many companies make it. It's not very profitable. And, the supply and demand can get really out of whack. And so some people get it and some don't, and then you have a big mortality event. So, yeah.
Thank you. Thank you for pointing out the yellow fever outbreak. And I enjoyed your mentioning the Ebola issues too, because I remember back in 2014 thinking, oh, that's terrible, people doing these things. And thankfully, I don't think it will happen here. And I was so wrong.
Yeah. I do think that lethal infectious diseases just frighten people. And when people are afraid, it kind of turns off some logic circuits in the brain. And unfortunately, I think some social media personalities really like fueling that. So they just continually generate content that's intended to scare people and then mobilizing them to do things that we might consider irrational, like drink bleach or other things. So, yeah.
Thank you. Yeah, oleander, that was another one.
Colloidal silver.
Exactly. Mm-hmm. But we do that for all sorts of diseases. And I want to thank you for pointing out the public health trend, because when I started back in public health, we need to focus on chronic diseases. That's how people die. The pandemic problem's mostly solved. We don't say this anymore, but for a long time, there was that we'll just move everything into chronic diseases, and we underfunded and started ignoring infectious disease, and we're paying the price for that now.
Right. And there is even a big shortage of infectious disease doctors, and that's projected to get much worse because, 20 years ago, people were told like, that's not a great specialty unless you want to work internationally. And so
I have heard people tell people that here.
That's too bad.
It is too bad. And there are shortages of, you mentioned tuberculosis earlier, and there's problems with leprosy in places where we can't get leprosy doctors. And this is something that we should have control of.
Right. And I mean, the other thing too, again, the lack of teaching of evolutionary biology at the secondary school level sort of bleeds over into medical school, because there is no requirement that you study evolutionary biology or understand how fast pathogens can evolve around human defenses. And so even sort of looking forward in a less pandemic-y world, then we still have antibiotic resistant pathogens and tuberculosis and staph. And so that's a whole other sort of set of challenges that we're likely to be seeing in the future.
Excellent. So I have one last question. Can a global health vaccination program for COVID help Americans improve their funding and education attitudes for vaccination planning and pandemic prevention?
I want to say yes, because I really want there to be better attitudes and more funding and better pandemic prevention. But I just feel like so much is uncertain right now in terms of the political leadership of the country, the economic resources needed for the United States to continue as a global health leader. It's just really hard to say. I kind of feel like we're at a tipping point and things could go a lot of different directions. So I want to be hopeful. So we'll just say, let's hope we can be hopeful going forward.
Excellent. So I want to thank you for your talk and your wonderful answers, and thank you all for your good questions. We are approaching 1, so I wanted to let her have a minute to finish up.
Yeah, I just want to thank everybody for coming to the webinar and for having good questions. I especially want to thank Connor for managing the IT stuff and apologize for the weird audio glitches. My home internet, I think it just has Zoom fatigue. And so I'm just not able to have the same constant connectivity. But again, thank you for coming. If anybody has any further questions, feel free to send an email. I'm happy to talk anytime.